Hello everyone, welcome back to our channel. It is today video we are presenting that very interesting and clinically relevant case studies on the blister forming staphylococcus infection. It is also called as a staphylococcus infection in the blister forming skin condition or often confused with an allergic reaction. It is associated with the fungal infections also, or it is a simple dermatitis problem. But in sometimes it is a real case of hide deeper with the bacterial activity. One of the most common culprit in this case is of Staphylococcus aureus, a pathogen known as producing the toxins that can damaging the skin upper layer and create a painful fluid forms as small blisters in the scalp and near to the hair conditions. In this case study, we will walk you through that entire journey of the patient initially presented with that what looked like that orientally in the skin irritation, and that over just a few hours it's a irritation process to multiple clear and pus filled blisters accompanied by the intense pain, redness and warmth. Then the rapid progressions of that raised clinical suspicions and promoting through the examination of microbiological testings. During this video, we will explore that infection, start with the risk factors involved in that and how the blister formed and what are the clinical impacts and diagnostic steps to help the confirmation of staphylococcus infection as that causative organisms. Well, also discuss about the role of virulence factors like the explorative toxins which are responsible for the separation of skin layers and leading to the blister formation of cells. We will go on to that, and this case study is especially useful for the students and the healthcare professionals who are wants to understand the real world presentation of the Staphylococcus aureus infection and how quick assessment you can see in that, and earlier treatment can prevent the complications, and also known as that to stay tuned with the dive deeper in the fascinating clinical scenario. My students going to present that case study. That student met with an GH in Coimbatore. So we will go on.
Good morning to all. Now we are going to know about clinical presentation. I am a student. I am studying career-based nursing in SNS College of Nursing. I am posted on Coimbatore Medical College and Hospital as my part of medical surgical nursing. There I saw a patient of Mr. Ganesh, 54 years old man. He is admitted on 26/4/2025 with the chief complaints of pain, irritation, cough, blister formation in the hair, and pus discharge from the hair. After the diagnostic evaluation, the doctor diagnosed as staphylococcus infection. The diagnostic studies are hysterectomy, physical examination, blood test, pus culture, blister formation culture. After these diagnostic evaluations, the doctor diagnosed as staphylococcus infection. After the diagnosis, the doctor is prescribed as medications like antibiotics, analgesics, and topical agents to reduce the blister formation. After this treatment, the doctor will give education about staphylococcus infection to the patient. After the doctor is give education about the staphylococcus infection to the patient, the educations are use private home. Do not get the hair and avoid the helmet and the caps. Use hygiene practices regularly. Avoid applying oil to the hair. Avoid oil foods and use paraffin free shampoo used to clean the hair daily. Okay.
Yes, I have a doubt about this. What are the histories we have to collect from the patient?
I calculated histories of age, name, gender, and maybe family histories, occupation histories, and family hygiene histories, and food control and lifestyle modifications.
What are the samples you are collecting from the patient?
We are collecting the pus samples, blister samples, scalp sample, and blood sample.
Okay, for collecting the sample after you are to dispose to the laboratories. Okay, thank you. So, and then they bring for us to conclusion of the case study of staphylococcus induced blister formation. Through these cases, we learned that what beginning as a mirror of skin irritation can rapidly evolve into the severe infection or to the compromised also. That infection of the bacterial to lead the increasing or the skin barrier is also known as that compromise. In these cases of that patient blister was that often leads blister formation to direct result of that staphylococcus toxins by the way of causing separation of one condition to another condition. It is a epidermal layer of important red flag conditions. After that, the clinical impacts also we have able to see in this case condition. So we are moving on to that, also known as how the proper diagnose and through the clinical signs to having the history taking and laboratory test also like a gram staining method, culture method, and we oftenly take at the antibiotic sensitivity test is play a crucial role to identify the confirmation of Staphylococcus aureus infection. The timely initiation of this appropriate antibiotic we have to advisable to the patient. Along with that, careful wound care, hydration and hygiene protocols also we have to instruct to follow the patient and help the patient to recover without the long-term complications. Now that moving on to this case, empathize that. So follow that importance of the early recognition, especially in the cases of setting like a hospital atmospheres and that hostels and sports environment and also community health facilities, salon shops, beauty parlors, where they step into the infections of the spread easily one person to another person. For that, the healthcare students across that nursing, physiotherapy, pharmacy, microbiology and allied health science also in this case of a reminder that in this clinical observation, that clinical observation and the microbiological understanding is must to follow the protocol of always work in hand-on-hand training. So this is our Staphylococcus aureus blister forming infection case study video. Thanks for watching in this detailed case study. If you have found any educational, making sure like that, and you have to follow us for more videos. Thank you.